sit next to you guys or stand? Does it matter?
Doesn't matter.
Whatever you're comfortable with.
Oh, we'll stand here and I'll probably end up sitting down.
There you go.
I'm always better with that. So PRP and PRF are under the category of regenerative medicine. And that's kind of the big push for things now. I mean, traditional medicine is giving people medicines to heal the problems. Regenerative medicine basically involves using your body to heal itself. And we do that with both these products, but also peptides and stem cells as well. And so what it does is it triggers a response to get your body to heal itself by ligaments and tendons. So it's a nice, more natural approach, and it's actually much more long-lasting. So that's why the push has been. Before I jump into what those two things are, PRP has been around. I don't know if anyone's has horses, but PRP has been around a long time. In fact, it probably started in the thoroughbred industry, really, because you had these, really high-power, very expensive horses, and they would bow a tendon, they'd pull a tendon, and at that point they couldn't walk, they couldn't run, so they were no good. So they wanted to get them back. So I don't know who came up with the idea, but they would draw their blood and inject it around the tendons and ligaments. It was an earlier version of PRP. It would stimulate an inflammatory response and then help that ligament and tendons heal. So it's really kind of interesting that it migrated from that, then it migrated into dentistry, and then athletes, and now us commoners. So, and so it's been used for a long, long time. I mean, probably more than 50 years, so it's been perfected. So I'll get talking about that. So PRP, there are two different products. One's PRP stands for Platelet-Rich Plasma, and then there's Platelet-Rich Fibrin. So PRP started out first, and what that entails is we take your blood and we put it in a centrifuge, and as you know, if you had a vial of blood drawn, you'd see that it's red. Basically, that's all the red cells. And in some people, we would inject that. That's how we did it earlier. We would try and separate them, but the red cells wouldn't always separate, so when we would inject it, some people would have a big bruise that area because the red cells were bruised. So the techniques have gotten better, the tubes have gotten better, and what we do is we take your blood, put it in that specialized tube, and put it in a centrifuge, and we spin it. And what it does is, since the red blood cells are heavier, they go to the bottom of the tube. And what's left is all of the kind of clearish, straw-like fluid. That's called the plasma. In the plasma is going to be platelets. Platelets are typically the things in your body, in your bloodstream that clog things up. They clot. So if you cut yourself, platelets are going to go there. They're going to release factors, and that's what's going to stop the bleeding, but then also start promoting healing. So what stays in that clear fluid is platelets. That's why it's called platelet-rich, because it's concentrated up in there. And then really all of the other factors that are in that serum. So that's how that serum is acquired. We then take that serum and inject it. And so it's done, PRP and PRF are done for different things, but PRP has much more generalized uses. And like I said, it has all the growth factors and supports tendon and ligament repair, but also stimulates collagen. One of the things that happens is when those platelets are kind of activated by the spinning, is causes them to what's called degranulate. So when they do that, they release the pro factor. So in other words, they release the signals to say, come here, we got to heal this stuff. And so there is actually healing from the PRP, but really there's two components. There's the immediate healing from the PRP, which lasts for several days of just what those factors are, but really there's the additional secondary signaling that happens. So which stimulates a cascade of more prolonged healing of those factors coming into that area. So what kind of things do we do with PRP? What would we use it for? Well, like I said, it started out for horses with for ligament injuries. That's what it first started out was in humans. It started out for athletes. A lot of basketball players, you'd see them twist their ankle. They didn't need surgery. There was nothing they could really do except rest. Well, that's when they started injecting the PRP in that area. They put it around the ligaments and tendons. A lot of times people had what are called micro tears. Instead of a complete tear of the tendons, they were frayed a little bit, just like a rope that would get frayed. And so on its own, that would heal, but it takes quite a while. The PRP in around that area basically stimulates much more accelerated growth. It does help with pain relief, but that's not the main reason it's used. It's used to really repair ligaments and tendons. That's its primary thing that it works. It works so well and it's so safe, it really has so few side effects, because it really, when you think about it, it's your body going right back into your body. So you don't really have a reaction to it at all. Interestingly, it does sting a little bit, which I'm not sure why it does that. I mean, because really, again, your serum that was in your body and then it goes back in. So the most common places we inject it are into ligaments, shoulders, biceps tendons, in the articular joint there, tennis elbow, all wrist stuff, knees, and even plantar fasciitis is a huge area that we treat with that. So plantar fasciitis is for people walking, they have some micro tears in that plantar fascia. That's the one that kind of supports your foot and acts like a cushion. And some people develop micro tears in that fascia, and it becomes very uncomfortable. So so they want to rest it. You get the roller ball, all of those things, but it's not very effective. But when we take the PRP and put it in there, it heals up very, very quickly. So that's some of the things that it's used for healing. It's also been used in aesthetics because, again, it was so safe. People go, why don't we try it for different things? The first thing it was tried for in aesthetics is dark circles. And that's such a common problem. People have hollowness under their eyes. And what you can see is that dark circles makes everyone look like they're tired. It actually is a thinning of that tissue under the eye. So what happens is you're actually seeing a reflection of some of the blood vessels that makes it look dark. So people look like, oh my God, what happened to you? But it really is just that. And so when we can put that tissue, that serum under there, it actually stimulates collagen. All of the factors that are actually in the PRP stimulate something. And so the most common things to stimulate is new blood vessel growth. That's called angiogenesis, and that helps with kind of restructuring stuff. And then it sets the cascade of all of the other things, the tissue repair, nerve repair, and all of that is what starts. And again, it's like a twofold process no matter where it's put. First, the immediate phase of it where the factors are really concentrated and start doing the healing, but then they sit and chain in motion the secondary cascade of it. So typically the factors last in an area really from 1 to about 2 weeks. That's it. So but the healing still goes on past that. So the factors aren't there anymore. So that's kind of gives you an idea of what it does. So people, that's what we reevaluate people generally 2 to 3 weeks to see how they're doing, whether it needs to be retreated or not. It is used in some things because, again, it's so safe. You can go back onto the other one about the joint things. It's so safe, and people had such good responses. We started using it on areas that we didn't even think it should work on. The most common one is knees. So people who have degenerative arthritis in their knees. In other words, almost all those ligaments and the cushions are gone. And so what happens, you've heard of that term, it's bone on bone. Well, there are cushions in the knee joint, and what happens is they just wear out, whether it's an injury or just time. And so that causes more friction, that causes that inflammatory response, which causes pain, and then a lot of people get swelling in those joints. In theory, the PRP shouldn't do anything for that, really, because what's there to regrow? It can't really regrow all of those ligaments. But it actually has the opposite effect. It really does work very well for people who have that. And it really gets rid of their pain, and it does help thicken some of that tissue. So it's one of those places where we say, listen, I'm not sure if it's going to work, but we'll try it. Well, people are very uncomfortable. A lot of people either have had surgery or don't want to have surgery, because that might mean either an arthroscopy or a knee replacement. That's kind of the go-to now. If you have anything, we'll just replace it. So a lot of people don't want to do that. Same thing with shoulder. So we try it. And so more often than not, people get very good relief of pain and discomfort, mobility, and all of that from it. So it's a lot less risky, less involved, less invasive, and it's your body doing that. So that's what's happening. As it evolves, people are doing more and more with it because you say, well, hey, let's try it. Let's give it a whirl. The only place that it has not been and cannot be injected is into people's eyes. That's it. People say, well, we'll help cataracts. No, it doesn't do. But every place else it's been injected. So it's interesting. It's used in men for erectile dysfunction and Peyronie's disease. That's where people have an abnormal bending. It increases blood flow, so it helps with that. And actually, women the same. It helps with incontinence. So what happens is when they get older, some of that tissue changes angles, and so people start to get incontinence. They start to have vaginal atrophy, vaginal dryness, and this helps when it's injected in that area. It regenerates that tissue, it stimulates it, and it brings it back. So it avoids surgery, it avoids some medications, things like that. So I'm just going to jump to PRF. It's kind of not, it'll follow that sort of, but I'm going to kind of jump around. PRF is, we've taken the PRP, that liquid, and we wanted something that would last a little bit longer. And PRF started out being used in dentistry. That's really where it was mostly used. When people were having not necessarily root canal, but they were having tooth and dental implants and having stuff done with their jaw reconstruction. They had bone loss. That's when they started using it. They made the PRP, they spun it into this, they heat treat the plasma, and what it does is it becomes a matrix. It almost looks like a clot. And that clot then is placed, they do it a little bit different than we do, but they make it a little bit more. They take that clot and they put it in that area and let it sit there, and almost like a piece of gauze. And those factors then release over several weeks. It provides structure from the matrix being there, which is good, and that helps stimulate bone growth and the other tissue, but then the factors slowly release through that matrix. So we started using it, the other rest of the medical community, for other things. Now, it's not typically injected into joints, but it is most commonly used in aesthetics. That's the thing, and it can be used in the genitals as well. So aesthetics is where we mostly use it for as a replacement or an alternative to filler, and it's frequently called biofiller. And really, what it is we take that PRP, treat it, it becomes a gel, and then we can inject it under the skin just like filler, which is hyaluronic acid. It works very well. The PRP worked well for dark circles. PRF works even better for dark circles. We could put it all under all of the tissue, under the face, under the skin, the neck, breast tissue, anywhere around here, and it helps regenerate that tissue and thicken it. And so it really is a nice, more natural approach. If people say, "Well, I don't want to do fillers, I don't want to get involved with that," this is that approach. So, and again, that the volume lasts for quite a while because you have that matrix that has the factors in it, but then slowly releases over time. Unfortunately, people have tried injecting the PRF into knees and stuff, and it doesn't quite work as well. It kind of actually creates a little different reaction, so it's really not used there. So it's really the PRF is just used mostly in aesthetics, and then when women when we're trying to treat the incontinence thing. So that's kind of where it's limited to.
Approximately, how long does it last?
It
Does
lasts
it depend on what you're
it's a two-pronged time period as well. So you have the initial factors that are there. Now these factors are going to stay longer than the PRP because they have this matrix which slowly releases it. So it's going to probably be released over 2 weeks. Again, now that factors are really triggering another response. So it's not just like, 2 weeks it's done. It's really 2 weeks that we're slowly releasing the triggers. So we just keep stimulating those triggers to then come back and heal that tissue or thicken it, collagen, whichever thing it's going to do.
And if you're using it for aesthetics, how often would you be getting your shots?
Well, basically what we do is we treat it, and we usually see people back in 2 to 4 weeks and see. Some people, like if they needed filler, they might need several syringes of filler to fix the volume loss. The same as with this. We can be a lot more aggressive with PRF than we can with filler because if we kind of overfill an area, because of the liquid that's in there, it shrinks down so you won't have really bad swelling or anything afterwards, and it doesn't look like you have that fake look of filler. And it's nice because you can put it in other areas where you really generally don't put filler. One area, as we get older, we lose volume in our temples, and it causes that hollowing. And so you can put it all up in that tissue there, and it stimulates that to grow, and then down in here and all around. So really at the 2 to 4 week mark, we reevaluate it. The skin, generally what we see is even if they still don't have 100% volume correction, the skin looks dramatically better. I mean, you can just see the integrity of the skin looks better, which is one of the things we want because as we get older, our skin gets thinner, and then that causes some of that crepey look.
What about maintenance? I guess I'm asking. Maybe I didn't ask that.
Yeah, well, I think it really depends. I think it's really, we do it, see the response, and then let it kind of go for some time. So it's not like, okay, every 3 months you have to have PRF and everything. Some people do it once a year, some people do it more frequently or less frequently. It really depends on the response.
So you just judge?
Yeah.
Okay.
PRP is also used, there's a big one now, it's hair loss. That's really a common thing. And so what that's doing is that is applied a different way. We can either use what's called a dermal roller, where we make micro punctures in the dermis, and we apply it topically to stimulate the follicles to grow and regenerate hair, or it can be done by injections all throughout the scalp. And this is really a big thing for hair regrowth. It's not going to probably work on me, that kind of a thing, but people start. Yeah, it didn't take. But as people start to lose hair or have had areas of hair loss, that's the best thing. It's almost all people that have hair transplants now are getting PRP afterwards. That's kind of part of their maintenance to stimulate. It's like fertilizing those follicles to get strong and stay there. It's not a particularly painful procedure, and there's not a lot of downtime with it for the scalp. Not just the whole. So I think we do a lot of PRP, and it really has taken off because it's so beneficial and there's so little risk to it, and it's not terribly expensive. And so that's a nice combination for things. I mean, because lots of people have ligament and tendon injuries. I mean, it's so common.
Would not work for arthritis.
Well, that's the tricky part, and it depends what you're saying. If someone has rheumatoid arthritis and they have a lot of inflamed joints, probably not. Although people are injecting stem cells and exosomes into those things, which is kind of the stuff on crack. But if you're looking at sort of worn out, like osteoarthritis, yeah, in theory it shouldn't work because there's really nothing there. But the reality is it does work on many people. So I usually have that discussion, say, listen, I can't tell you this is going to fix everything, but what are your options? You know, tell them this is the risk. You're going to get an injection. It may or may not help. Or, you know, if they don't want to have surgery, it says I'm absolutely don't want to have surgery. Well, maybe they're too sick to have surgery. They just can't do it. So those are the ones we tried it. And actually, quite often people get significant pain relief. And the thing is, it might not be complete. You know, so they might not go from a pain scale of 10 to 0, but they may go from a pain scale of 10 to 5. And so they can deal with that. They can live with that. It buys them some time to, you know, maybe try and retreat it or think about it. Because when someone's at a 10, they're willing to kind of sign up for anything at that point. You know, they're on pain meds. They're like, yeah, just fix this. I don't really care. And not that there's anything mischievous about doing those joint replacements, but I think it's almost like a labor epidural when you're talking to a woman in labor. They're going to say yes no matter what I say. You know, when they're going to do it because they become uncomfortable. And the same thing starts happening when people's joints are that uncomfortable, no matter what it is, the shoulder or whatever. They're going to say, okay, ideal, let's just do something, whether it's guaranteed at the end or not. What are you thinking?
I have a lot of questions.
Come on.
Me too.
Bring
I
'em.
have Ehlers-Danlos, and I have multiple, so the back, I have multiple vertebral instability in my lumbar spine, 5 herniated discs, 2 synovial cysts, and then I also have a failed posterior lateral root horn meniscus tear. I had a surgery in 2024, it failed 10 months later. So I know that meniscus can't like regrow, but would the tendons and ligaments around the joint, because it slips out constantly.
Mm-hmm. I don't know the 100% answer to that, but it's one of those things where people say, you know what, let's try it, because honestly there's very little risk to it other than having the injection.
Right.
Yeah. So when you start talking about herniated disc, that is an area that in your spine where people have started pushing the envelope of that. So in the beginning, stem cells, PRP, none of that stuff was injected into that space. Now it's quite commonplace that people are doing stem cells in the epidural space around inflamed nerve and all of that. So all of these things, or in the facets, or all of the ligaments in that area, basically to avoid surgery, because you know it's not always just surgery equals cure, fix, no pain. That's what we want. But with people who've had surgery, you know it's sometimes you just switch one thing for another.
They won't do surgery because of my Ehlers-Danlos,
Yeah.
and it would fail because I've already had failed other surgeries. So that's why I strength train as much as I do, because I have to keep my muscles tight because my ligaments and my tendons aren't doing the job.
So
Yeah, PRP. I've done a lot of research on PRP. I just haven't pulled it.
Yeah, I mean, I think what I would suggest is you find one joint that, you know, this one bugs me, and you could really do a test on it and you know, try it, inject it all different areas in there and let it sit and see what happens. Sometimes when it has to tighten those ligaments and do that, it's not as quick as some of the other stuff. But, you know, I tell you, if it was me, I would do it. I've injected PRP everywhere. It's safe. You know, it's pretty safe. It's pretty easy to obtain. All your blood spin, it's ready to go.
So, where do you inject it in the muscle, in the tissue? Like, where is it being injected?
So it depends what the problem is. It's generally not injected into the muscle. It's injected, so the most common areas we inject it is around ligaments. So again, the most common problem I see people come in is shoulder pain. it's usually the biceps tendon, which are in the front, so it's every time I lift my arm, I get hurt, and you can actually feel those areas there. And really what you're feeling with that soreness is micro tears. So it's hurts when you move it, so it creates that inflammatory response. The other thing is golfers elbow, tennis elbows. Those are both micro tears that cause that. So what we do is we find what's called the insertion. That's where the muscle attaches to the little bit, attaches to the bone, and that's where we kind of just flood that area. We do it right at the one spot, but we just put it all around because you can get a lot of it and it's safe to do, and why not? You know, just put it all around, just like fertilizing the area, put a little bit more in there. But typically not into the muscle per se.
So if this is already in our body, you know, collagen and the plasma and stuff, why isn't it already doing that job?
Exactly. It's really weird. Why isn't it fixing it? I know. I don't have that answer. But we're taking it and manipulating by spinning it, causing those platelets to concentrate and then degranulate. So now, so that being said, one of the downsides of PRP is as people have more medical problems or as they get older, the quality of their PRP goes down. So of course, PRP is at the best quality in the teens and 20s. The people that generally need it the least. And as we get older, when we need it more, sometimes the factors go down. And in that case, what would happen is you'd either have to repeat the number of injections, or then you start looking at adding external ones like, you know, PRP that's isolated from amniotic membranes or stem cells, where you can get those factors that are very highly concentrated. If someone is really debilitated, has a lot of medical problems, it's probably not going to work. You know, just plain PRP. And so, you know, that's a decision that we talk about. I mean, some people say, yeah, please do it anyway. Okay. And, you know, because as long as everyone's on board, and it's really nothing bad's going to happen from it other than the stick. But yeah, it's interesting when you see young guys that come in, these young people that play football or basketball, and you put it in there, it's like a miracle. They're like that. It's just frustrating for us older people.
Can I ask one more thing? And I mean, I have been researching this, but why do the majority of doctors, why are they not using them? Like,
Or peptides, or a lot of other things they should be using.
like they say it's not approved, it's not, I don't know how much you said, but basically they don't even, why wouldn't you go over that as a first line other than surgery, because that's less invasive,
Well,
not
I
as
mean,
expensive?
you know, there are some orthos that do it, some of the sports guys are, and this is what I tell people, and it's kind of a brutally honest answer that they don't want to hear. If you're going to a surgeon, his answer is going to be surgery. So, you know, if you have a hammer, everything looks like a nail. So, that's part of it. And you think, well, they're not necessarily doing it out of malicious intent. That's what they're trained to do. So, but there are some sports medicine docs that maybe aren't ortho, but they do that. They do a lot of PRP. And there are people in town that do it. There's a fair number of them who do stem cells. But probably your traditional family practitioner has had no training, has not read one thing about it. So to them, it's voodoo. It's just black magic. It doesn't exist. And so we already know, after going through all of this stuff, the FDA approving and all of that kind of stuff doesn't always mean a lot, you know. And so there's been lots and lots of trials of PRP and stem cells, and it's safe and it works. And the same thing with peptides. Why aren't peptides? Well, I can tell you why peptides. The biggest opponents of peptides are the pharmaceutical companies. They have selectively bought out, or they did for a while, bought out the companies that were making it and shut them down. Not that they even wanted to own them and sell them, they just wanted to shut it down. Because why, you know, rant, why would I want to fix you with a shot if I can put you on a medicine for the next 30 years? It doesn't make good business sense to do it. And it's sad. It's sad that that's a kind of a disgusting mindset when we should be trying to fix everyone. There's going to be plenty of other problems, but that's what it ends up being.
Most peptides you take continually, or several of them.
It can. It depends which ones. There are healing peptides like BP 157 and T500. That's just done for a month at a time, so they're not done continuously.
I take some.
Yeah,
I
yeah.
take them regularly.
Yeah. And so you can on and off them. Some of them are for your gut, but you don't have to keep doing them all the time. Yeah.
Thanks.
And there's lots of different peptides. You know, there's peptides that, you know, help with muscle activation, help with anti-aging. So there's all different ones. Do you have any questions?
So arthritis.
Yeah.
Does it, I mean, is it just you have bad arthritis in your neck, right?
Yeah.
So, is there hope if she tries it, or, and in age making a difference in the quality,
Of
is
the
that
fibers.
where the stem cell might be something that
Yes.
would be needed rather
So
than?
there's a bridge product, which is the product we get called BD-Pure. It is the equivalent of PRP, but it's harvested from what are called the mesenchymal cells of the amniotic membrane. So it generates its same thing. It has about 10 to 50 times the amount of factors our normal PRP does. So in someone who may have decreased factors, we try and use that because it's going to give it the best shot it can. So it really depends where we're treating. If it's like bone on bone up in your neck, it's probably not going to fix all of that because there's so little room in that area. It's a very frustrating problem. I have it myself. So we just try to mitigate areas, and there's some areas you can treat that are going to help feel better, but some not.
So with herniated disc or really bad arthritis in your spine,
So people are doing it for herniated disc, for sure, up and down, cervical, all the way to lumbar. Again, why? Because it depends, really. So if someone has a herniated disc and the disc is completely protruding and pushing on the nerve, probably it's not going to do much for that. But a lot of times when people have herniated disc, it's just a finding. And so if you do MRIs on everyone, probably 80% of people have herniated disc somewhere in their back. And it can relate to time when they had pretty significant back pain and it went down. So this is just sitting there. Now what happens is that can aggravate things as it, in time. You can bend funny and that disc may extrude a little bit more, but not only necessarily the disc extruding and touching stuff, there's all that disc material is very inflammatory to the nerve, so it causes a lot more pain. So there's a lot of things that are in there. And then other just local tissue things. So if it's not obvious, like, well, the disc is cramming on that nerve, it's not going to fit, but that's not what most of them are. Most of the people have had it, and they have these things, and that's when it's tried for them. So typically the options that people have for herniated bulging discs or any of that kind of arthritis, epidural steroids, which is a steroid shot, or this. And people are pushing more towards this because it's safer. It definitely has more regenerative abilities than the other. The other one's just shutting everything down. People are definitely doing hips. They're doing burses. We do that a lot. A lot of people have hip pain, have labrum tears, things like that in there, or just greater trochanteric bursa. That's the one that holds your leg here where people walk because it hurts. That one gets inflamed. Piriformis muscles, which are all the muscles around the butt muscles that come in here. The insertion where they attach get inflamed and aggravated. So we can find those areas. Those are really prime for treating because that's that's really where the injuries generally are. So putting people on medicines, they kind of just dull it. They're not going to really fix the problem.
So I was here mostly for under eyes,
Yes.
dark circled and crepey skin.
Yes.
But with like the fillers, you have to be worried about possibly injecting it into a vein. And so like, what's the safety of that for your eyes?
So yes, that used to be a big concern when people got fillers. One of the things when people got fillers, in the older days when I started, we used to just put filler in with a straight needle. So you would inject it, and you did have to worry about lots of bruising because you would hit some of those little capillaries there. People would get filler, they always look like they had a black eye, and you're right, vascular occlusion. What we have really almost all gone to now are what are called cannula needles. And they look bad because they're a long needle, so people see them, they go, oh my God, you're going to use that. But it's completely dull on the end, it's rounded. You could go like that and it doesn't do anything. And the holes are on the side of it. So when you're going to put in filler, PRP, PRF, you will make what's called a pilot hole. You'll numb an area, make a low hole because it won't go through the skin, and then you just go in that tissue. And it's dull enough that it just separates that stuff and doesn't generally enter in the vessels to cause the occlusion. So whether it's filler or PRF and bruising. So a lot of places where we couldn't really do it was under the eye. We can do that there. Nasolabial holes, there's lots of blood vessels here. You don't want to inject because you could get occlusion there. It doesn't happen with that. Under eyes, really, the two big ones for that is going to be PRP or PRF, really. And you just flip a coin, whichever. Generally, people do a few more treatments with PRP, and we've had people like dark circles, and they progressively get better. And then usually what we do is don't just sit and put it right here in the tear trough. That is one area. I usually infiltrate what I have left, because I will have extra all in the cheeks, and just put it all there. So it kind of stimulates all of that collagen. It does thicken the skin and help while it's there. So I'm not supposed to put it there. You're already there.
Is there any risk of having like unevenness, or like, what if you put too much in it?
Well, so the answer is yes and no. Filler, absolutely. So filler is much more viscous and thicker. So yes, you do have to be careful, make sure it's even. One of the nice things about filler is you can massage it, but still you can get unevenness. One side asymmetrical. With the PRP, it's pretty much liquid. So if I put too much in and it's overdone, which I do sometimes just to get a lot in there, the next day is going to be pretty much absorbed. PRF, there might be a day or two more than that, because we've got that matrix in there. And I do actually overfill it, because I know there's going to be a lot of shrinkage with it, because even though the matrix has that tissue, there's still a lot of liquid, that serum in there. And so I kind of overdo it, knowing it's going to come down a bit. I mean, if someone said, well, I'm going to a wedding tomorrow, well, I probably wouldn't do it. But, if you're planning on doing it, then I want to give you the best bang for your buck. I want to put a lot of factors in that area, so I'm going to kind of do it. It's also just us putting that needle back and forth under the tissue creates an inflammatory response. Every time you do inflammatory responses, that stimulates more factors, and it helps actually grow. Another thing that PRP is used for, and I kind of skipped over, is microneedling. So people are doing microneedling for the integrity of their skin, to help with acne scars, for helping with the thickness of their skin or their scalp, and you could apply the PRP onto that, or even a CO2 laser, which does make punctures to stimulate it, to really kind of jack it up a bit, the response. You apply the PRP on that, and it soaks into all of those little cannulas that the hole's made, and it stimulates more factors, so it kind of just really amplifies that treatment to get more out of it.
Is there a price difference between PRP and PRF? I mean, I'm just curious, like.
There is, and I can go over any pricing and all of that, when you, after he's finished, and then if we're coming tonight, we also, there'll be a special around PRP and PRF, that, it's 20% off of either, any of the services, for attending tonight, so.
If we have something done, can you do it? Can we request that you do it?
I pretty much do most of it, so.
Okay.
You can request it, but I'll be there anyway.
Okay.
Yeah. And it's really interesting the number of places you can put this stuff, because as you start doing it, well, this little thing here works, can I try it here? Can I put it here? And, is it 100%? No, but a lot of times you're taking Motrin to leave, you're rubbing all these ointments and creams on it, nothing's helping, and so, I mean, I checked it, but I have all kinds of things too, I mean, as we get older, so, but I'm gonna give it a whirl.
That's good.
Yeah. SI joints, that's another place in your back, your lower back, that's where your sacrum attaches, your spine attaches to your pelvis. And it's really a non-movable joint. It really shouldn't move, but it really does in practice. So people will get inflammation, get arthritis in there, and it causes a lot of diffuse low back pain and spasms down here. That's where a lot of people have pain. And so that's another area that you can infiltrate that area into that joint, but also some of the muscles and ligaments that are around that area to help cut that inflammation down and help heal some of that. And again, some of these things, if we can reduce some of it, it's improvement. Yeah, well, that can go to zero. That's what I love. But, I don't consider it a treatment failure if I took someone from a 10 to a 5, because they already now can rest more, they're getting a little breather. So it's helping something. And it's not terribly expensive. I mean, when you look at this